Hello and welcome to the Here For It podcast with Chris
and Melissa.
We're two sisters that are here to bring you real and relatable topics that we hope will inspire you,
Cause you to think, laugh, and grow.
If you hear something you like, please remember to like, subscribe, and share.
And now, let's get into today's topic.
Yes. Do a little flick of the hair.
What you talking about? You don't got to be dumb.
Okay. I know it's so low.
Yeah.
What can we do?
She can scoot up,
just
scoot up a little
yeah.
bit,
If she scoots up, she good.
Okay.
All right, y'all.
Yeah, all right.
Hey, thank you.
Thank you.
Music or what?
No.
Y'all just start.
We
Yeah.
just started
Okay, got
and then
it.
we added.
Yeah.
So hello and welcome to the Here For It podcast with Chris.
And I am Melissa.
We have a special guest in our building. What is your name, ma'am?
My name is Brandy.
Hey, Dr.
Brandy.
Brandy.
Dr. Brandy.
Okay, Dr. Brandy.
Yes.
We are so happy to have you here.
Yes.
So
I'm
listen,
excited.
it's so awesome when you have friends that are doctors. Not many people can say, I have a friend
This
that's
your
a
friend, she a
doctor.
friend of mine too. I be like, oh, Brandy? Oh, girl, I get my prescriptions from her all the time. She's a great doctor. She's a great doctor.
Yeah, so we brought you on the show to talk about women's health. We want to talk about everything.
Everything,
All the
yeah.
questions that you want to ask the doctor, but you know the doctor got to be professional, so they can't really tell you. We're gonna try to get them in real quick. With
Exactly.
Dr.
And if you
Brandy.
dying, you can ask any question you want to. Just put it in the comments and we'll let you know if you're dying or not. All right?
Yes.
If you gonna live
Later.
6 months,
Dead.
69 months.
We gotta let you know. So let's learn about you. Tell us a little bit about you outside of being a doctor.
Okay, well, I'm married.
How many years?
15.
15 years. Oh my gosh.
Bless the Lord.
Yes,
Bless the Lord, because y'all know marriage
Yes.
is tough.
It's
Okay,
tough.
so we've been married 15 years. I have 2 amazing sons.
Aww.
They're amazing.
I love them
They're
so
real
much.
cute,
Y'all,
too.
they are really good. They're
Yeah.
really good. I don't have no complaints.
Yeah.
And my oldest is 12. My youngest is 10. They really take up the majority of our lives.
Yes. Yes, as children
I have
do.
like 3 jobs. I know I am a doctor, but I'm a doctor for like lots of things.
Oh.
Yeah. So, I actually work at the hospital.
Okay.
So I'm an internist. So you actually don't want to see me unless you have to be admitted.
Okay.
don't
You
really
said
wanna
an
be.
internally?
Yeah, internist.
Internist.
Yeah,
Okay.
so that's an internal medicine. I'm a board certified internal medicine doctor.
Okay.
But I work as a hospitalist, which means I work in the hospital for Piedmont Hospital. So you would
Okay.
have to get admitted to see me. So
Okay.
it would be something like, we treat a variety of conditions, whether
Okay.
it's pneumonia or stroke or
Okay.
a heart attack or monkeypox. We
Yeah.
were just talking about that.
Yeah, we don't talk about
Yeah,
that.
we
don't
all talk about that.
Talking about that.
Because my mind is blown.
I just showed them a picture and they're like,
I'll never be the same.
I never. COVID,
Okay,
variety. And
okay.
then I have a secondary job. I work for a company called Resurgia.
Okay.
So they are in home. So they come to your house
Okay.
and a nurse practitioner will come and see you. Let's say
Yeah.
you can't get to the doctor's office. So
Right.
they will come to your house and
Right.
then I supervise the nurse practitioners.
I didn't know that.
Yes.
Oh,
I've been
Lord.
doing that for about two years now.
Okay. So how do you even have time?
Yeah, I'm like, what do you-
How do you
know.
do that?
Your skin is so nice and just your hair is all.
you don't
girl,
look-
I
you
would
don't
be
look
looking
fresh.
like James Brown. I can't do this.
Listen, and then I work later at night for my hospital doing remote coverage. So
Girl.
I also take call from my hospital
Okay.
on my free days to help them out. So the nurses will call till 11 p.m. at night. I mean, y'all, it's
Do
a
you
lot.
have to do?
I know. It's you
Well,
know
thank
how-
you. I want to just say thank you.
Yes,
On
you
behalf of
are
all
an
the people.
essential
Right.
worker.
No, seriously.
Yeah.
You're an essential worker, y'all. You can't say no. That's the
Yeah.
thing. Like you can't.
Yeah.
There's always a need, and so you
Girl.
feel like I got to do a little extra. So
Yeah.
we all at the hospital,
That's
most
sweet.
physicians do a lot of extra
Yeah.
work.
Wow.
So, you have friends when you're young, little kids be like, I want to be a doctor, I want to be a lawyer.
That's
Were
what
you
they
one of
say.
them?
Yes.
Or from little?
5.
But you were for real. Because
No,
I done said that and I knew I didn't want to be no doctor.
Baby.
I want to be a doctor.
Y'all, let me tell y'all, it's really doing what God wanted me to do, because I knew I wanted to be a doctor. I said I was, and my dad was like, he was a pastor.
Okay.
And he's gone now, but I'm telling you, he told me, he said, God wants you to be a doctor.
Really?
And you know, when I was 5, I didn't know what that meant. So I was like, okay, yeah. He did. And then I got to college and I thought, I like law, or I like business. I was confused. Like and that's what I tell a lot of people in college. You can get confused because everything is interesting, right?
Yeah.
And then he said, pray about it. So I started praying.
Yeah.
And God showed up in my dream and said, no, I want you to be a doctor. Stay on this track that you're on. This is what I have for you to do. And I'm telling you, it was the best decision I've made.
You're such
Have you always been like, I feel like doctors have to be science minded and good and,
in
those
biology
types of subjects
and math.
Did you enjoy them?
I did. Let me say this.
Such
I
a
really
nerd.
She called me and said weirdo.
She's different.
I just like biology and math. I actually like math so much I thought I was going to be a math teacher. Really? Like I took all the math classes and
was excited about it.
To another college and took more math because they didn't have enough in my college.
No.
That's how crazy I am.
You're talking about what do you calculus and statistics and all of that?
I took everything. So I took everything you could take in math, and then I was like, but they're not gonna make a lot of money.
Yeah.
She put on her Medea calculator.
Because I like money.
That part.
I like money. I was like, he gonna take care of me on
That's
this
right.
track.
That's
That's why I stayed, y'all.
So, did you choose internal medicine, or did it find you, or
How
does that?
me. Let me tell you, there was a lot of stuff because I thought maybe I could be a dermatologist.
Right.
Then I thought about being a radiologist. That's when you read films, X-rays, MRIs, CAT scans. I thought about a lot of it, but then y'all, it was internal that kind of scared me. I was like, wait a minute, now I can't know everything about everything. It's just too broad. I was like dipping my hand and everything. That's when the Lord was like, that's what you need to go in.
That's what it is.
You need to know about everything.
All of it.
Yeah.
That's why we got you here, because you know about
We're about to ask you about all of it.
Everything.
Not everything.
Everything. But outside of being a doctor, what do you like to do for fun? Like, what's your hobby? What do you like?
Can sleep be a hobby? Because I love sleep.
We just talked about it.
I love sleeping. Okay, let me say
It's like
this.
it makes you smile thinking about it.
Y'all, I need so much rest. My husband is like, you always want to go to sleep.
Right.
I love it.
It's good.
Okay, besides sleep.
It's amazing.
No, seriously, we love to travel.
Okay,
Like, that is so fun for us.
Yeah.
Like, I want to go everywhere in the world that I can go. Like, every single place.
What's the coolest place you've been so far?
Where have you been? That's
Y'all,
just been
you know,
amazing.
we went to Italy this summer, and when I want to say
That was it?
It was top notch.
Wow.
I love Greece too. I would recommend Greece.
Okay.
Italy. I would
recommend everywhere Europe.
Right.
That's
Okay.
that's my goal.
Now I'm a beach girl. I love the sun, so I can go to any ocean.
Yeah.
So I love Jamaica.
Okay.
We go back every
islands.
time this weekend.
Yeah.
I love it. But I'm telling y'all, traveling.
That's what you into.
When I tell you, I'm about to take the kids. We're gonna go to Africa.
Yeah.
I wanna go
Everywhere.
Now, have you been afraid to travel, or been a little more reserved because of COVID and all this kind of stuff? Just being a doctor and knowing.
Crystal, I should, but
right. No, that's okay.
YOLO. In the hospital, y'all. I mean, we had COVID floors where all you were seeing, 2020, were COVID patients. And I was getting so overwhelmed that every room, 40 rooms, it was just COVID, and people were dying, and it was stressing me out. And I got home one day, and I told my husband, I was like, I'm booking this flight to Jamaica right now. And he was like, wait, but I'm going too. I was like, I mean, if you want to,
but I'm going. You better take off work. So what was the doctor community doing to keep each other encouraged during COVID? I could not imagine all the people dying
and the deaths and
the COVID floors and being afraid to not get it.
I'm telling you, we were stressed out. I don't know if we did the right thing. We were doing the survival thing. It's like somebody's got to see the patient.
Yeah.
It's going to be us.
Yeah.
We can just cover ourselves.
What did y'all have on? That's what
okay, so we have the N95 mask.
Okay.
And then we would put a surgical mask on top of the N95 mask. So we put the surgical, I mean, the N95, the surgical mask, we had shields.
Yeah.
And then we had gowns.
Yeah.
So honestly speaking, we were honestly very well taken care of in that aspect.
That's good.
We weren't worried because we were, you know.
Yeah.
We were covered. It was the outside world that we worried about. When you
Right.
stepped outside the hospital, that's what you were concerned
It's
about.
really not safe there. Well, I'm happy that we've moved past that a little bit, but now monkeypox is on the scene. Okay.
Yeah. I was joking about monkeypox.
Melissa said, "Is that a real thing?" I said, "Girl,"
Because I haven't seen nobody walking around with
Yes. Now let me say this.
it or catching it.
No, and I told Melissa this. I have not.
Yeah.
And not that it doesn't exist. That's not what I'm saying. But we have not in our hospital seen it in patients that are not immunocompromised in some way, and that could be HIV or people who have cancer or chemotherapy.
Yeah.
But their immune system is compromised, and those are the
And
ones
then
we're
here
seeing.
come monkeypox.
Yes.
And that's on top of it.
And so, is it being sexually transmitted?
Yes, but you can spread it by contact
Just touch.
as well.
Okay.
Right. So you know, it's fluids, it's secretions. So I'm
scared of that.
So
you unlikely will get it if your immune system is normal.
it's normal. Okay. All right.
So
and then just stay away from people that.
Now listen, if you know
have
somebody
it.
that has it, it takes about 2 to 4 weeks normally for the lesions
awful.
to kind of go away.
Oh, to go away.
Go away.
Okay.
Go away.
Oh,
Yeah.
they go away.
Yeah, they do.
So the image that we just saw, that will heal.
That will get better. I did show them an image that was very it was
monkeypox.
Yes, it was full of it.
It was a bad case that I saw, and it will get better. Now you may have scars after you know.
Kind of like chickenpox. I used to have like chickenpox.
Yeah.
This may be worse. The scars may be worse, but it will get better.
That's a long time.
And we have a treatment now. We have an experimental treatment.
So is it a shot or something you just take orally?
Yes.
Okay.
It's called T-pox.
Okay. Wow.
So usually it has to be the specialist, and I'm an internal medicine doctor, but there's an infectious disease doctor, and they will treat it.
So for real, what do doctors wear to protect themselves when they go into a patient that has monkeypox? Because I wouldn't go in. Right. I wouldn't. I would call off.
Listen,
Maybe it was like, you know what? I quit today.
Call me when monkeypox
Give me my
is over.
401k and I'll figure it out.
No, we have good protective gear. We have gowns. We have plastic gowns, and each plastic gown is a tear-off gown. So you put it on and you tear it off. You
rip
throw
it
it
off.
right in the trash.
Okay.
Of course,
and gloves.
Absolutely. Listen, I really am very cautious now, especially with COVID. But I shake people's hands with gloves.
Yeah.
So I put on at your door. I'm putting on my gear on, and then I'm going straight.
And you still shake their hand? That's nice.
To keep them that you're human.
Because they are.
They need contact.
Yes. Everybody, they're sad. They're depressed.
Yeah.
It's hard to be in the hospital. And during COVID, they were alone. They couldn't have family.
Oh my gosh.
It was heart-wrenching.
That's tough. Did you ever have moments where you had to, I don't know, like just encourage people or share your faith? Or like, how do you?
I want you to know I have cried. I have prayed with thousands of patients. I would be like, what do you want me to do? And some of them would just be like, I need you to pray. And I said, because we come to a point, as a physician where we don't have an answer.
Right.
And sometimes we get to a point where we're like, listen, we need a miracle.
We need a miracle. We need a higher power.
We need to call on Jesus.
Yeah.
So we call on Jesus together. If that is what their faith is, I will do it with them.
Oh my goodness. I couldn't even imagine.
Yeah.
Thank God for you.
Right.
Thank God for Jesus Christ. Yeah. Doing what I'm supposed to do.
That's what he told, your dad told you that you were going to be. And this is the reason why.
Now, what's the pay range of like what? If a kid wanted to be a doctor.
You might go. Because I need to know what I gotta do.
How many figures?
I'm just trying to borrow $50. If I get $50 right,
does it matter like the type of doctor that you are, like the numbers and stuff like that? Yeah. And do doctors get like raises?
They get bonuses.
We do get bonuses, and we
based
get
on
raises.
what?
How many?
The patients you see. So our hospital is I work at Piedmont Fayette, but it's a very busy hospital. And when, I think it was Southern Regional shut down. We had more of their patients come toward us. And now Atlanta Medical is about to shut down November 1st.
Heard that.
So they do, they have an average that they know is a normal average for a doctor to see in the hospital. But most of the time we're way above that average.
So you're going to get a bonus off of that.
Yeah, bless the Lord. We work.
A little bonus. Okay.
So what's the highest paid doctor? That's what I'm trying to figure out.
Right. What kind of
anesthesiologist?
No. It would be the surgeons. It would be more
the surgeons,
neurosurgeons, the orthopedic surgeons, the bone doctors. They would make the most.
So
So I mean, listen, you doing brain surgery, you deserve some money,
some
good money. You operate that range.
Wow.
To operate on the brain.
I'm thinking about changing my major. I'm thinking about it.
Dr. Fowler.
Let me tell you, Morehouse is accepting applications. We need more black doctors. That's what I want to say.
Wow.
We need more.
What's the ratio, just like even in your hospital, would you say?
Y'all, we are blessed because we recruit each other.
Oh, nice.
So we like
if you like it.
Brown. So we recruit a lot of each other, and we take a lot of Morehouse. So a lot of us went there, and so we will know the ones that are coming.
Yeah.
So I would say that we have a good.
Is that where you went? Did you?
That's
go to
what I'm
Morehouse?
gonna say. I didn't know that.
Yes, I went to Morehouse Medical School. Yeah.
Oh my gosh!
Y'all, it was the best experience of my life.
Really?
Let me tell you
What
why.
was so great about
it was to have brilliant African American doctors teaching you how to be a doctor. It gives you not only a sense of pride, but you're like, I can do this. Like, I'm smart enough. They are telling me I am.
Yes.
I can do it. And they want you to win. They're like, you gonna know this information. You live, breathe, die. So they really pushed us.
Love that.
And my father-in-law was actually one of my professors. Like,
That's so cool.
Yeah, he's the head of neurology there. So he taught us neuroanatomy.
Wow.
Yeah.
That's
talking about
Jason's dad.
Really?
Yeah, he's brilliant. He has a PhD. And he's the neuroanatomy professor.
Oh,
he teaches you all about the brain and everything that's going on.
I know he liked you, didn't he?
I don't know. I was in the back struggling. Run that back. I'm coming to your house later. I'll be here. I'll get it.
Right.
Now, were you married before or after medical
I
school?
couldn't do it. It was after. I told, we talked about it, and I was like, I gotta
be focused.
And I didn't actually see him a lot, to be honest, y'all.
Wow.
He was patient enough.
What was that like? Did it put a strain on the dating relationship?
Not for me, because I was too focused.
It didn't even matter.
That's how doctors
If you want me, you go wait.
I was like, go chill and have a good time.
Yes,
and
live your life.
Focused, and we'll, come together at the end. And that's honestly what it was, because I really didn't have no time. I was in that library. If I was depressed, I was in the library.
Did you like it though? I can't imagine studying like that. I have a friend.
You know why? Because we all you know how you have a group of people and you're
like,
all
do it together.
Friend, we're doing it together.
We're doing
and
it together.
We're bonded because we're together. So everyone is stressed. So no one was.
It was your group that you were with. So you weren't missing the party.
Yeah, no, we weren't.
Y'all were together.
Now listen, I missed my whole 20s. Can I say that one more time?
What
because you have to sacrifice to go to school. You have to go to college. And then I went to medical school for 4 years. And then I did residency for 3 years. And then I was the chief resident at Grady. And I stayed an additional year. So, I mean, you're talking about 4, 4, and 4.
Yeah.
You know what I'm saying?
I
missed 12 years, which was all of my 20s, which I would never. I'm not upset about it, but I want people to know that that's
the commitment that you're gonna make.
That's amazing.
Yeah,
and
it's very mature to do.
You know what?
It's a different type of mindset.
Like, this is what I want.
I want this, and I'm going for it all the way.
And I'm going to deny myself.
Is it not the best decision? Because we can get on the plane and go to Italy right now.
You can. There you go. Yes.
Bless the Lord.
You can do what you want to do.
It's delayed gratification.
It is delayed gratification.
Yeah.
That's all it is.
That's amazing.
Yeah.
Let's talk about STDs.
Oh my God. Let's talk about
So, do you see those types types of patients? Are they typically younger? I mean, because we're in Atlanta, right? So
yes. Crystal,
And
I have
everybody
a lot
got
to say
one.
about
say
this.
it. Tell
They
us.
got
Melissa, everybody got one.
Everybody got one.
Listen, and let me say this.
They be
Honestly,
doing
as a
it.
physician, I really want to make sure that people don't feel ashamed. And
Okay.
that's what I really don't want. Because, everyone was young at one time.
Right.
And people have made mistakes. We all
Right.
have. And we all could have gotten
Right.
caught up into
Right.
whatever.
Some stuff.
So my most important thing about STDs is that you let your physician know, or go to the clinic. Or
It's
go
like,
to the
quit
pre-clinic.
lying.
Like, don't
hide it.
Don't hide. I ain't
Yeah.
not your mama. I'm not gonna call
Yeah,
her. I want
yeah.
you to just be honest and tell me.
Yeah,
So yes, we
I
live
bet
in
that's
Atlanta.
hard, though. Yeah.
For the younger people, because you just don't want to have that stigma.
So what do they be coming in acting like they don't know?
I'll be like, I'm in. What they say, I'm itching.
They be moving every 5 minutes. They be like, you good? You be like, I'm good. Scratching.
I used to work for the IDP, which is Grady's clinic. It's a free STD clinic.
Okay.
And so,
Ooh.
y'all, we had stars coming there, but they used other names.
Superstars,
Yes, they did.
celebrities.
But y'all don't.
No, they used another name, so we didn't.
But y'all know who they are.
Well, it doesn't matter.
when
They
you
don't want
see
it
them.
to be documented.
Yeah, and that's
So,
smart.
Yeah.
Oh,
You don't want your
but
name on that. So.
Can they do that? Can you do that?
Celebrities can do that.
Okay,
So-
and it's
at a free-
free.
It's a free clinic. So
Why you at the free clinic? Oh, because that's why.
correct.
Because
So
they
you
can
don't-
do that.
You can just go and get tested for free, and then your treatment might be like $50. So you
Right.
know, who's gonna know?
Okay, I'm gonna throw out some names if they can.
Blink twice. Blink twice.
Did you see Usher?
Usher, I did not. Usher, I love you. Don't have me playing.
I apologize.
We gonna take this offline to find out who been in there.
Yeah, but they come up in there,
They
huh?
do, because it gets to a point where you have symptoms.
Yeah.
And, the most common
need
ones
some
are going to be your
medicine.
chlamydias,
Yeah.
gonorrhea, HIV.
Yeah.
We live in Atlanta,
Yeah.
so it's HIV. Between DC and Atlanta, it goes back and forth about
With the
who's
HIV?
Higher.
Yeah, and so you know.
Is it mainly males? I guess that's a dumb question. It's not. Wow. Okay.
It's women. Women
Wow.
ages 15 to 24 are usually the highest. And
Y'all
they're
hear
usually
that?
Black women.
What? That got HIV?
Yes, yes.
So are they like being trafficked?
Promiscuous,
Are they
or-
what's
I think that a lot of times your partner could be sleeping with other people.
Sleeping around.
That's what
you know,
happens.
and people are moving around, and
Yeah.
then that's what happens. Some partners are on the DL. And so you
Yeah.
have those people
That's
who,
awful.
have not come out about their sexuality or what they're doing. So when you come in, I always am, who are you sleeping with?
Yeah.
Is it men, women, both? I mean, what do you
I know that's
consider
uncomfortable
yourself?
for them.
Yeah, but at
Do they
that
usually
time,
tell you?
Yeah,
Okay.
because
You got to. I'm in here
Be like,
with this
both
they
of them.
don't know me at all.
Okay,
Right, exactly.
You know, if you come in and you just seeing the doctor, you're gonna
Yeah.
be honest because you want.
Yeah, but
and-
you like a young, black, cool, cute doctor. So I wonder if that would be a barrier, like for a guy that's like, I'm burning, or how do
Yeah.
they
They
receive
don't
you
love it.
specifically?
Right?
You know,
They don't. But
you need
They
the
need
help,
you want the treatment,
right?
So-
Do you want the help or
Your
not?
pee is
Yeah.
burning, so you better
Yes.
speak up.
Do you want this ointment?
Right.
Put it on your finger.
So put on your finger.
Do you want it?
Yeah, so they are normally, once we have a little communication, and I tell everyone the same thing, of course, I would love everyone to wait till they get married.
Right.
Yeah.
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 But
That's
if
why.
you are finding yourself doing that, then I think
Yeah.
that you should, have your partner and yourself tested.
Yeah.
Before.
Before you engage.
I think they should do some over the counter at home tests. I think more
They do
people
have some of those.
Oh, that's
Oh,
so
do
nice.
They have
To-
HIV over the counter. They have swabs. Yeah. You can.
Yeah.
So you just
so
test
that it's more
beforehand.
private.
Yeah.
But
get
we
some
did a
tests.
conversation. We did a podcast about sex.
Right.
And we talked about having conversation about sex before you have it.
Yeah.
Like
Yeah.
it's important to talk about.
Yeah.
It is not always, in the spur of the moment, people are in the heat of the moment. They're
Right.
like, it's more of a mature,
Yeah.
take your time,
Yeah.
show me. And you can't test for every every STD at home. You can do HIV,
Okay,
but,
okay.
there's herpes, there's gonorrhea,
Right.
there's chlamydia.
What do you say?
there's
Like,
HPV.
let me see your private parts.
You be
before
like,
do
hey,
this.
no, you be like, hey, baby.
You like,
Cut the
oh,
lights
let me
on.
see.
You should. I think you should look. should, you know.
Scabies. Ain't that like crabs?
Yeah,
or that's
it's
different?
like it is like a
animal.
I know. It's like, you know, you can have mites or bed bugs. Scabies is one of those that burrows into the skin. But
have you seen that?
You gotta be kidding me.
You can pick up a lot of things sexually that are not considered STD, but you can still pick them up. So I would look, you know, you want to look for outbreaks. I mean, if people are having lesions, open sores, groups of bumps together, you know, I mean, it could be a herpes outbreak. You know, we have syphilis cankers, which is just a sore, and it's a painless sore, which is why a lot of people don't know they have it. It can be in the genital area, and you don't know you have it, and then it goes away.
Yeah.
So how do you prevent yourself from getting it? Like, is that examination every day? And
well, let me say this. I think if you are with one partner, which I would like to be your spouse, but if it is one partner, like I said, everyone get tested so you know beforehand. And you can go to pretty much any clinic and get the gamut of testing. Right. So you'll know where they stand and where you stand. Yeah. And then listen, you know, my OB,
you know,
my personal OB, and she's been my OB. She delivered my kids. Yeah, she doesn't care that you're married. She's the type that says, you know, people are out here still. Unfortunately, they cheat and people slip around and they do stuff. So she says every year when you come and get your pap smear, I still run the gamut because I want you to know just in case. So, you know, I think that's appropriate and smart. I think once, you know, if you're more sexually active, you should get the test more often. We recommend every 3 months.
Yeah. Oh wow.
But you know, other people you could do once a year. If you're, you know, with the same person and you're not worried. Yeah. But you know, I think everyone should. Yeah. Should.
Oh man.
So what about
high here? It's high in
Atlanta. Yeah. And what are those conversations like? Are they difficult for you when you have to tell somebody, hey, you have HIV, or you know, the test came back
it came back positive.
Yeah.
It is very difficult. Because you just, you know, it's part of my job, but I don't like delivering bad news. I mean, I do, but I do it every day, but we don't love it. But you know, I go and I have a sit down.
Yeah, you just have your way to do it.
I have to sit down and we have to talk about it, and then we have to talk about, you know, what the next steps are. And what the treatment looks like. I've had people fall out, roll on the ground. Yeah.
Acting up.
What do you mean?
I had some guy, I think he found out he had it. Yeah. And the girlfriend did not know. And so we had to like call security on her because she was trying to come
I
and
bet.
kill him.
Yeah. I bet.
She was like, you killed me. You didn't tell me. But I think, and I'm not blaming him, but I'm also blaming her. Like, you both should have been responsible.
Yeah.
So I
have friends that got herpes from just, they were totally fine, got with a significant other, like girlfriend, boyfriend, and that person gave them herpes for the rest of their life.
Right?
That's crazy.
Forever. And you can just have a breakout at any given time, you know, so you could have to take suppressive medicine for life. And y'all, the statistics are showing that about 50% of black people have herpes.
Really?
That's 1 in 2.
That's a lot.
That's a lot. It's more than you think. Yeah.
So, because you're a doctor, do you ever, like, just when you're outside of work and you come in contact with people, whether it's STDs, STIs, whatever, do you diagnose them? Like, are you?
Y'all, I do.
You can't not do it.
I do it.
What I don't do it, Brandy. I swear. She might look at me like, girl, your eyes got yellow.
I do. I do it to people.
Yeah.
Because let me tell you, most of the time, like,
stay away from them doctors. Sorry, go ahead.
Brandy like,
because when you are practicing that, y'all have been out for like going on 13 years. So you know you see the same
you
thing
just
over
know
and over
it.
and over. So when I look at someone, I can look at their neck and say, oh, your neck may look a little thick. I feel like your thyroid may be off. And I will tell people to go get their thyroid
That's what
checked.
I wanted to say.
Yeah.
So will you tell them?
I will tell them. I do. I would never let you
Okay,
just
just
walk around.
text me, whatever it is. Don't tell me to my face.
strong. They're gonna be like, Crystal, your sister.
Yeah.
Look at her neck.
And we see a lot of heart failure. I know people don't know what that is, but it's when your heart muscles are not contracting well.
Okay.
And so when you're not your body is not squeezing the blood, which means pumping it out to the system, it can back up into the lungs and back up into the legs. So people get short of breath or their legs get very swollen. What? And so I have seen people where their ankles are very, there are other conditions that swell your ankles.
But that's one of the indicators.
Wow. So when I see that and they tell me I ask them their symptoms. I have seen people at church and I do that. And I'll say, make sure you go and get an ultrasound of your heart. I have.
Tell me, you see me?
Yes.
Other than being chunky.
No.
Other than that, that's normal.
That don't count.
Y'all, it's when you practice. Y'all know my best friend is a dentist.
Yeah.
And she does the same thing to people.
Baby, I stays away from her.
I know.
Watch how she was looking at me like this.
Close your eyes and imagine starting your day in an auditorium filled with other dynamic women who are fearfully and wonderfully made. Women who are strong, overcomers of adversity, who are chosen, never alone, and always loved. Women who desire to understand how God intended them to be as a wife. Now, open your eyes. Ladies, we are so excited to announce the Wife U Conference. This one-day conference will be held on January 21st, 2023 at the Riverside Epicenter in Austell, Georgia, just minutes away from downtown Atlanta. This conference is for wives and women that would like to become wives. Our goal is to equip you with the tools and the resources that you need along your wife journey. We'll discuss topics like defining your role as a wife, submission and respect, and transitioning from single life to married life. We'll talk about effective communication, sex, getting what you want without nagging, conflict resolution, triggers, mental health awareness, and so much more. When you arrive, we'll open up with praise and worship. We'll have pictures, we'll eat lunch, and we'll get to connect with like-minded women who are there to encourage and empower one another on this life journey. We're asking all attendees to wear black and/or black and gold. The black symbolizes the death of the old wife or old way of thinking, and the gold because we are royalty and all daughters of the King. So ladies, tell a friend and come on out. Let us wife you. It's a higher learning for a higher purpose, and we can't wait to see you there. Tickets are on sale now at wife-u.com.
Just like somebody that's into interior design, they see color, you see walls or events or whatever your specialty, you see it.
I look at people all the time, or they honestly, people will come and ask me.
Yeah.
They'll be like, "Now, what you think?" And pull up their shirt, like, "What do you think this is?"
Now, does that annoy you though? Because don't you want to take your doctor hat off when you're not at work?
You are a super doctor. That's your superpower.
Y'all, I feel like when I tell people this, because let me say this, like y'all said, it's nice to know a doctor, right?
Yeah,
so you can just like take.
Well, like
I'm
me run
lucky
something by
I
you.
know I know neurologists, I know infectious disease, I know gastroenterologists. You know, I would literally text them for any problem, be like, "What do you think about this?" They answer, and I feel blessed. I'm like, "Oh my gosh!" So I want to be that blessing to other people. I'm like, if you need me, call me.
I got you.
Crystal,
I don't know. I'll be like, friend.
Now you might not find me after that. I'm gonna show up. I'm gonna show up.
That's dope. That's dope.
So let's talk about health, like food and diet and how that plays a role in health.
Specifically women's health too. You know, I know this is breast cancer month. That doesn't have anything to do with it, but
and I'm getting my mammogram. This month I'm getting my mammogram.
I need to get mine.
I need to have one.
Everybody should have one. Health is important. Now, listen, it is breast cancer, so please get your mammogram.
Yes.
No, I be
check the
feeling like 'cause I
tatas.
don't have no titties. I can't have it.
No, you can have it still.
Okay,
I check mine all the time.
I check them.
This
It's nothing but chest there.
But breast exams once a month is very important. So that's mostly how people. And y'all know they say most partners find it. So most of the time it's your husband that finds it. They'll find it and they'll say, "Oh, babe, I think I feel a lump," because usually
they feel it on
you know it's a lump when it's so much. I be like, this is lump.
No, you might have what we call fibrous, fibrocystic.
So it could be some lumps.
It can feel your breast tissue are dense, so they can feel lumpy.
Let me feel
but you will know the difference between that and a real lump.
Okay, gotcha.
Okay. It will feel different than your norm.
Okay.
Does the lump feel like, you know how when you breastfeeding and you get those
milk ducts?
Yes.
Does it feel like
them
that?
It will feel hard like that.
Yeah.
But it will feel also like solid where it's stuck.
And will it hurt?
That's the thing about cancer. No, it doesn't normally hurt. Cancer normally doesn't hurt until the end, to be honest. But you will feel a lump, and normally what makes us nervous is that lump is not, sometimes your lymph nodes get swollen.
Right.
They're mobile. You can move them underneath the skin, but generally a cancer will be a stuck hard
right there,
and it won't move, and that's
it's so scary.
Jesus.
I'm gonna get my.
It's the number 2 reason that caused that cancer. Number 2 cancer death. But
really?
Yes, it's lung and then it's breast.
I don't think I knew that.
Mm-hmm,
I always thought people
African American women are more prone to
breast cancer. Yeah.
Why is that? Because of what we eat?
Well, honestly, I think it's a genetic thing. Okay. When we get cancers, we tend to wait longer to get them checked,
diagnosed,
and they're usually more aggressive.
Yeah.
And so by that time, unfortunately, it's sometimes it can be late, because we will literally wait till we're like 55 and say, "Oh, okay, I'll get a mammogram." Right. Well, you should have had it maybe. Should have had it.
Should have had it.
Yeah.
Check your breast.
Check them. Check
your
boobies,
tatas.
ladies.
So
do
please,
it
tonight. You know what? We need a moment of silence right now.
I'm
And
gonna
check
right. Your breast.
Start at the right,
all the way out under, all the way around, and just move in like
in like
always
this.
Toward the nipple. Okay,
she just want to feel herself at this point.
I'm a demonstrator.
She gotta know her body.
Because I don't need that.
Yeah, you want to go all the way out, underneath, all the way until you get to the end. Yes, once a month.
Once a month.
Yes,
wow. So have you seen people, whether it's breast cancer or any type of cancer or whatever, change their diet and get better?
It depends.
Okay.
And when I say that, I am very much about your health, your wellness, your diet, eating properly, high amounts of. Listen, when I say high amounts, like 7 servings of vegetables. If you're not getting that, we already have a problem.
Yeah, I haven't been.
Yeah,
no, I haven't been. I need to do better with that.
Here in America, we can eat
some greens.
Some greens last night.
Right, more vegetables.
I think our issue is waiting until you have the cancer and then trying to.
I got
right
you.
now, we at stage 3 and stage 4.
I got you.
It's a little late. I'm not saying it doesn't work. There are a lot of naturalists out there.
Yes.
But this is what I don't like, ladies. I don't like for people to. Not do the prevention and then jump on it after, and then not want to do any medical therapy either.
Okay.
Y'all know I'm a physician. Now we're gonna have to do reason.
She's a
Okay.
Yeah.
So you push us the reason.
You push that medicine on us.
Listen, eat right. Get your diet right. Okay. I don't care if you take vitamin C injections, but you're gonna come get this chemo when you got cancer. Let's do it all because you want to do everything to live. Okay. That's what I want to say.
So that's the goal.
I agree with that.
Do you understand what I'm saying?
Yeah.
Do the natural stuff, but please do the stuff chemo. That has been proven also to work. They give you longer life. Yeah. I had a lady, honestly, let me tell you the story. She came in, she had lung cancer, and she had like 3 masses, 2 on, I want to say it was 2 on the left side, 1 on the right. Yeah. She was like, "Oh no, what I decided was," she told me and the oncologist, "I decided I'm going to just do the natural. I'm going to go." She went away to one of the herbal places. She said, "I'm going to get vitamin C injections. I'm going to do all these cleanses. I'm not against that. Do it." But she was like, "I'm not going to do the chemo." Okay. Y'all know we saw her back 5 months later, and they had tripled in size the masses.
Wow. Yeah. And it was too late.
And so had she gotten chemo, obviously it
would have helped.
You want to shrink or you want to get surgery, remove the tumor, whatever is the treatment, and then do the lifestyle. So what I want to say is prevention is the best.
Yes. So we're eating healthy.
I like everyone to be plant-based, but no one listens to me. But I would like most people to
talk
be
about that
plant-based. Okay, so unfortunately, there's a lot of mass-produced, and people tell me this all the time. Well, hey, how do you know the vegetables are safe? Well, listen, the vegetables, they don't put like hormones in vegetables.
Right.
They generally are not or animal. I mean, vegetables.
It's some
antibiotics.
issues with them.
There may be issues,
ain't no hormones
but there are most of the time you can wash off pesticides.
Yeah.
You can wash off things like that. So I tell people high amounts of plants. Like if you're not getting 7 servings of vegetables, we're already
a day.
Yes, a day. Start off with green drinks. You need to be eating salads. You need to be eating cooked and raw vegetables with your dinner every single day in order for you to have enough vitamins, in order for your tissues and your cells to work at optimum. You cannot eat hot Takis every day. You cannot eat Doritos. That's what I tell my patients. You can't eat like this and then think you're going to live till you're 95, 100.
You're not.
Yeah.
Everything is what you put. We will live.
We are what we eat.
Yeah, and what we smoke. Okay, so we got to not smoke and what you're drinking. Yeah, even alcohol.
Can we talk about alcohol?
Yeah.
On the lungs and stuff. I mean, because alcohol, I guess alcohol has always been very popular, but people be just drinking.
No,
I don't know nothing. I don't know much about it.
I don't either. I don't drink. But tell me.
I have had alcohol every now and again, and that, when I tell you it really is, and I really don't drink like that. I don't really like alcohol, so that's why I don't. Yeah. But they're changing how we feel about alcohol. And so, they used to say a glass of wine is okay every day.
Right.
And a lot of people will fight me on this. But now when you look at the studies, they are concerned that alcohol, unfortunately, even wine is causing cancers. Whether it's breast in women, liver.
Yeah. Leave that wine alone.
And a lot of alcohol, if you're drinking
or in
very
moderation.
Heavily, right. If you're drinking very heavily, you can get oral cancers.
Really?
Yes.
Now, what about to you? I thought alcohol damages your liver. No.
Yes, it does.
Yeah.
Yes. So you can get cirrhosis of the liver without getting cancer, but generally cirrhosis after so many years leads to cancer.
Wow.
So I would say, minimize. If you're going to drink alcohol, I would minimize. Like when you say every now and again, it should be every now and again. It should not be every night. Yeah. So they took back that study. They used to say a glass is okay every day. They took that back because now they're finding that
it's not healthy.
So to me, the smoking and drinking, the two main legal substances, cause more harm than probably all the.
So when you're saying smoking, you're talking about nicotine.
I'm talking about nicotine,
cigarette, not weed.
No, I'm not talking about weed.
Because weed is good for you, right?
Well,
look at her. She say yes.
No, I'm just. You've been smoking weed. No, I've never smoked weed before.
Okay.
But
it's an herb. So
it is an herb, and there is medical marijuana.
Yeah,
and they are definitely trying to legalize, and I think it is. It comes in oils and it comes in different things. So it does help in certain conditions, I will say. Especially they've been giving to kids who have seizures and it kind of calms that down. Yes.
Give them a little weed.
Yeah, even in people who have severe pain, chronic pain from like cancer pain, they use it. And So I do know there are benefits. Now, inhaling things into your lung is where I'm like, I think that's the part where it goes wrong. It's not fully studied. Now there are a lot of people smoke, and they will tell me there is nothing wrong. I don't feel no problems, and I that's okay.
Right.
But I personally, we haven't really studied the effects of that year after year after year after year, and see if that it's not known to cause the same as cigarettes.
Okay.
It's true. It's not tobacco.
Well, but it's so funny how that's illegal and cigarettes and alcohol is legal because they want us to die.
That part.
They will legalize it, I believe. It's coming because they want to make money off of it, just like they make money
of course.
So I'm not a proponent of smoking weed. I just want to say that. But
yes, she is.
I've never smoked weed.
Brandy said when I came over, she was like, "You got that good."
My doctor said
I'm just kidding. No, then not at all.
But I do believe in medical marijuana for certain.
Yeah.
Yeah, I really do. For certain disease states.
So let's talk about mental health and medicine. So first of all, my question would be, you guys been seeing an increase, especially since COVID, of people that have mental health issues? What's out there? What are you seeing? Tell me about it all.
You know, I was going to mention celebrity, but I'm not going to say that name.
Go ahead.
I need the celebrity juice.
Oh, y'all know I'm talking about Kanye.
West,
Y'all know I like Kanye.
Yeah.
When I say I like him, I think that he does have some mental issues.
You do.
I'm wearing his shoes right now, and when I tell you they're the best shoes ever,
Comfortable.
But I think that, you know, when traumatic events happen in our lives, such as COVID, death, you know, the mental illness that we already are struggling with and maybe suppressing can just show us.
It comes out.
It manifests.
Okay.
More.
So I think that, you know, the depression levels hit an all-time high. Being at home all the time and feeling like you're locked up all the time. Feeling scared all the time of going out your house and dying. So there was a lot of that going on. Now, some people say we had less school shootings and things like that because everybody was at home. True. But the domestic violence went up to 83%.
I know it did.
And
I bet you divorce was right behind that. Divorce was right behind it.
83.
What?
So, yeah, they said kids were getting more abused. Spouses were getting more abused.
Lord have mercy.
Yeah,
stuck in the house?
Yeah. And it's a lot of traumas that people weren't dealing with. Listen, y'all had Sonya, they need to call her.
Yeah.
A lot of trauma, and then it just kind of came out during that time. So yes, we did. And then we I think y'all as the physicians, we got a little depressed.
Right. That's
I
can imagine.
Yeah, just seeing people. I would talk to people, and the next day I would come back and they died.
They will be
and I was
gone.
like, wait. He's dead. I left, and I thought
he was okay.
He was okay. We were speaking. He was on a little oxygen, and all of a sudden he was intubated and he was dead the next day.
No, thank you. I couldn't deal with that.
You know, it was depressing. I'm telling y'all, that's why I got one day. I came home and I was like, I have to leave.
Yeah,
and like
going to
mentally,
Jamaica.
I'm
breaking down.
and I had to go to Jamaica and get my life back together on the beach.
I understand.
It was very stressful. So I can't imagine how.
I felt a little bit of that because during COVID, we stopped recruiting because people weren't working, there were no jobs, and I went over to the benefits team. Yes. But my place on the benefits team was health and wellness, and so because the increase in COVID, we had patients that had a lot of mental issues, and then there were patients or teammates that we worked with that died on us, and we had to deal with their families and deal with that. So that was tough. That was an eye-opener for me to say, wow, this thing triggers not only from physical health from COVID, but it's mental and it's death and it was a tough time.
I mean, we literally have people being like, "Can you open the window? Can I just walk to the front? Can my family come to the window and wave at me?" And then we even let the families do that. We had windows at the door, so we would have the families walk in with their mask on and stand at the window just to see their family.
Y'all couldn't imagine
because they were like, "We don't want our family to die by themselves."
And what are you?
I have busted
and your mind is going crazy in there because you're like, I think I'm about to die,
and I can't,
and I'm by myself.
And that was the time we were keeping people 2, 3, 4 weeks a month in the hospital, and it was very.
So is that happening now? None of that's happening now.
Well, people are coming in for COVID, but they're staying less. Okay. So I think the variants, as they have mutated, have become a little weaker. Yeah. So that those initial variants that came out were I'm telling you,
baby, that Delta variant, honey,
was taking people out. But as they mutate, they kind of, it's like the common cold. You know, every year it mutates a little, and you can deal with the common cold. Y'all, even the flu, it does mutate, but we still have about 20, 30,000 people in the U.S. die every year from the flu.
That's true. And
so you
nobody
still have
talks
people
about that.
That are viruses, but it's just less. It's not. And so it's less severe right now. Although, you know, there will be people that still die. They have immunocompromised situations. That will die. But at the same time, you know, as the variants change, we hope that the virility decreases.
Yes. Now tell me about, so with the people that are coming in depressed or having mental health issues, are you guys prescribing them medicine?
Yes.
Or
Yes.
Okay.
And listen,
she said they say hell to the
Tell us about medicine because
You know I don't believe in no mental health medicine.
I be like, give me my pills. Give it to me.
I had told Crystal this before. Okay, we had discussions about many things. You know, we have a girl group and we discuss many things. Crystal, you know what I'm saying? Right. We all have a good girl group. We always talk about all kind of stuff. We love our chats. We have lots of chats. But honestly, I think that I notice when people cycle through things, that's when I know they have a problem. And I told her, being upset or sad about an event is one thing. Somebody died and you're grieving. Or something. But when a family member is like, hey, every couple of months they're doing this, or they're having what we call manic phases, and that might be bipolar. You're up and you're down. You're in a manic kind of, heightened, state. And then you go into a depression. Or you cycle through depression. You're up, and then for a couple of months you're good, and then you cycle down. And so when you start noticing this, the chemicals in your brain are off.
That's so how they get off?
Well, listen, aren't we? Now we were born in sin.
Okay.
So they shaping in iniquity.
So you think they've been off, or sometimes something happened?
I think they develop and get off,
throw it to the left,
more off.
Oh, it gets progressively worse.
I think it definitely gets progressively worse the older you get, and then you can have situations that trigger those things. And so I think that it's just like, I can have high blood pressure and I need high blood pressure medicine.
I know.
I can have coronary artery disease and have to take a statin to lower the cholesterol. So then why can't the hormones in my brain, the serotonin and the dopamine, will be off? And you need to balance those out with some people. Otherwise, let me tell you what, you're going to just keep cycling. And then one day you get tired of just being in that state, and you come to get some help. And Crystal knows I love some Prozac. I be like, right then,
so what is Prozac specifically for?
Okay, so Prozac is an antidepressant.
Okay.
It's what we call a serotonin reuptake inhibitor.
Okay.
So all that means is serotonin is the happy hormone. It gives you that giddy, everything is light. So what Prozac does is it doesn't let serotonin is reabsorbed in the brain cells called neurotransmitters. So it goes back and forth. But what Prozac does is it blocks it. Okay. So it blocks it from going and being absorbed. So it keeps more happy hormones around. Yeah. That's what it does. So it makes you feel right. It makes you feel good. So
all the time, but I feel like it be fake some happiness. People be just like, they just be stuck being happy and they don't want to be. You be like, your grandmama died, fool. I know. But I'm so happy.
Well, that's actually good. And some people tell me, they like, what if I get addicted? I'm like, but you need to get addicted.
No.
What's the problem?
So do you take it? Do you take it for the rest of your life?
Now listen, you can come off. There are people who do come off, and there are times where are harder than others, and they have to take it for a short time, and then they cycle off. But then there are people who take it year after year after year, and they're fine.
Keeps them regular. Yes. Keep their medication.
They actually have a real hormonal imbalance.
It got to be another way to get it back balanced. No,
it's just like cancer or a sickness. You need medicine to make you feel better.
Yeah, I listen. I do believe in medicine, but I'm with Crystal. I believe in cognitive behavioral therapy. Yeah, so I think there are therapies that will walk you through, like, hey, this is triggering you, and you're going down, and you feel like you're getting into that depression. Yeah, then you have somebody kind of talk you through it, so you
balance.
Can.
Okay.
But I believe in both. I believe people can need both the cognitive behavior and the medication.
Yeah. Wow.
So I actually, there's Lexapro, there's Zoloft, there's Prozac. Yeah. They're all the same, serotonin. So there's different brands that make them, but they all kind of
do the same thing. Mm-hmm. So
I'm gonna have to pray about it.
If you mental.
And you know what? And we do talk about, this is part of the women's health too. We talk about having really bad PMS. Like, when
can we talk about that?
Let's talk about that, because it's a lot of people have PMDD. That's
girl, what is it?
So that's just,
I think I got it.
I know I got it. What is it?
That's just when you have your hormones have switched, they have dropped. Okay, so when you're ovulating, your estrogen at that time kind of peaks and it starts going down. And then what takes over is a hormone called progesterone. And that takes you from ovulation until when your cycle starts. Okay. So right before that, when your cycle's about to start, now the progesterone starts going down, and you're like, I'm moody, I'm anxious, I'm mad at everyone, I'm angry.
Oh my gosh,
and everything is that progesterone that you're missing. That's that give you that. It's almost like a serotonin. It gives you that good feeling.
Yeah,
it's a sharp drop when you're going, and so when it drops, you just can get PMS. It's basically what it is.
Awful.
And it can be awful, but you know what they use for that?
What?
Prozac? They use Prozac.
Oh Lord.
Oh Jesus. I need that for my marriage. Let me tell y'all, period Prozac.
So happy. They be like, thank you, G. Give her something, Lord. Yes, and start that, because a lot of OBs will start that, and women who have really bad PMS.
I did not know. So I only have one good week out of the month.
Wow.
One good week.
Melissa, this is where I'm being so serious right now.
Oh yeah.
You really think
I have one good week. And that one good week is right after my cycle. Mm-hmm. That 1 week, I'm on top of my game.
Right.
I'm in love. Right. I'm happy.
Right.
Everything is beautiful.
Your estrogen.
And then I got 3 weeks. 3 weeks. I be walking around here depressed. Brandy, I walk around like this.
Wow.
I can't get it. That's why I don't come out a lot.
Now listen, I do recommend, I tell women this all the time, go and get your levels checked, because honestly speaking, there are ranges where our estrogen, our progesterone, even our FSH, which it stimulates the follicles in the ovaries, and then our LH, which is another hormone that helps the wall to get ready for the pregnancy. Well, all of those levels, y'all, anything in your body can be off, to be honest. It's like your thyroid can be off. And that can throw your hormones. So I would get your levels checked to see if they're normal for your age.
Okay.
And then, of course, you tell your physician about it. But, I'm always about start it and see how it works for you. You can start a small dose of any type of antidepressant and kind of see. It's not, they have ranges to go up, and then we check
different levels.
So I really think, because when people get on them, they feel so much better. Like when I tell you, they're like, my world.
They can't just drink some water and
get some Robitussin.
Get some Robitussin. She be like, they got allergies, drink some water. I'm like,
get some Robitussin.
Now listen, I'm serious.
Wow.
I'm not a drug pusher, but what I am saying is, because our bodies aren't perfectly made, we're not in the New Jerusalem.
Right, not yet.
Everything can be off from head to toe.
Yeah.
You're going to need medicine at some point in time for something in your life to help you.
Yeah.
Wow.
I agree. I agree.
I think you do the best you can. Of course, exercise, eating, like I said, the vegetables, the fruits.
Yeah.
Try to eat organic if possible. Even organic is not perfect, but it's still better than the regular.
Yeah.
So I would try to eat all of that and do everything you can. Yeah. But then, there still comes a point where you still may need a little help. And I just want to tell some people, my patients, thank Jesus that he gave us the knowledge to come up with some of this medical therapy.
Yeah.
My mom,
he knew he was going to need it.
A heart device. And thank God she got the heart device.
Yeah.
Or she could die from heart failure. Do you see what I'm saying?
I do.
So we need the medical therapy.
It's scary.
I think I agree with that. Like you talk about, we never went to get counseling, or we don't want to take medical medicine, but we're all born and shaped in iniquity and sin. We got some things that are off.
Yes, I just want.
And is it okay to be off? Because sometimes I'll be like, you can't tell people, oh, I'm off.
Oh, I tell people they off all the time. They don't like it. But
can you spot it easily?
Now she knows this. Let me tell you.
Everybody's crazy.
Oh my God. I don't think everybody's crazy.
No,
but seriously. Honestly, I told her, my dad was a pastor, so I grew up in the church. So there's a lot of mental illness that does run rampant in the church.
Yeah.
And then we have family members.
Yeah.
And then I've had thousands and thousands of patients. And so when you put all of that time together, it's easy to recognize.
Right, you can spot it quick.
Mental health or even medical issues. It's just like you just see it so much. And so it's
so you can spot it. But I have a question. Do the doctors ever have mental health issues?
All the time.
They be mental, don't they?
All the time.
That is
but y'all take medicine though. Do they take medicine?
They prescribe it for each other.
Right, that's what I want.
Yeah.
Like if you ever see a doctor, you be like,
you right,
cold blue on the third floor. Hey, go up there and check on Susan.
And listen, most of them, they are not afraid to take that medicine.
Yeah.
We will call a friend and say, hey, can you give me this? this.
I need it.
Or you be like, I know what I'm getting you for Christmas.
Your prescription is coming.
Your first 2 refills on me.
Me and Crystal, we talked one time. We had a friend, and I was like, girl, I think she needs some Prozac.
Yeah.
And Crystal was like,
that was the first time.
That's the first time you agreed to medicine.
Get that one, so. But yes, do it.
She might.
Oh, that's crazy, man.
I'm about it.
Yeah. I'm on your side, dog.
I'm being
No, yeah,
mental
true.
illness is so serious.
Yeah. And I feel like it's more prevalent now.
We don't take it lightly. So
Yeah.
if you feel off, we want to get you the help you need.
Yeah, get you some help.
Yeah.
Now let's talk about women's health, but just a few more things. Women's health in the bedroom.
Yeah.
You know,
like coochie health.
Yes. Coochie cleansing.
Yes, and
to douche or not to douche. What to do after sex,
to douche
before or not to douche.
Okay.
That needs to be questioned.
Definitely don't douche.
Okay, don't do it.
No douche.
Listen, I've heard many gynecologists say this, and they're correct.
Yeah.
The vagina is like a self-cleansing oven.
Yeah.
So you do not need to douche at all. Now, there are times when you feel like it may smell funny or it may be off.
Yeah.
And that can happen for various reasons.
That's what I want to know. Why would it?
Right.
Why would it go
awry?
We have bacteria there.
Why your coochie done gone awry?
Coochie goes awry.
Yes, it does. It can. But we have natural bacteria that's there. And sometimes one of the bacteria is called BV. It's bacterial vaginosis.
Yes.
So it's
that's not an STD?
No, it's not. We took it off the list of STDs.
Okay.
Because it's bacteria that naturally occurs.
I don't have BV, but thank you. In my head, thank you.
Well, it's a natural bacteria, and so it can over proliferate. And so sometimes your partner, just their chemistry, their sperm, their semen interacting with yours can cause the bacteria to just build up too much, and it can cause what we call a fishy odor. We do like a whiff test. Yeah. And so you may need some antibiotics.
A whiff test.
Like you just get a whiff of it.
You say, you just do that.
When you put the speculum in, and you crank it open.
Yes.
It's a whiff.
So you whip it?
Yeah.
You gotta whip it?
How many whiffs do you have to take?
It is one whiff.
One whiff.
One whiff will take you out.
Actually, and let me say this: most of the time you get the whiff before you put the speculum.
Yeah, so you already know.
Yeah. So,
but are there different whiffs? Like, this is a sexually transmitted disease whiff.
Yes.
And this is a whiff.
So there's a mild fishy odor, which would be VV. There's a strong.
What's that?
That's trichomonas.
Oh.
That is an STD. Yeah. Most of the time, your gonorrheas or chlamydias will not smell, so you won't know that. Yeah. And then, your genital warts or herpes lesions, you could see them.
Yeah.
And I even had a patient where I didn't actually see anything. I looked with the speculum and I said, I'm going to look, and I didn't see anything. Yeah. But then she had anal warts once I looked down, because you have to kind of look everywhere.
Now there are musty coochies out there.
Listen, there are.
Yeah. It's a lot of them.
So I think that if you notice a foul odor or even a different odor, and you're like, this is not correct. I always tell women, go get a vaginal swab. So you go to your OB. Okay. They just swab it with. It looks like a long Q-tip. They'll swab it. And they'll send that for culture. Okay. And we'll figure out what it is.
What it might be.
Is it a yeast infection?
Okay.
Is it TB? Is it an E. coli infection? Is it an STD? Yeah. So they can swab your cervix and swab your vaginal area. Yeah. And you have to be careful with the sex. Now, I don't judge anybody what they do in the bedroom. Yeah. But
let's talk about what's the do's and the don'ts,
the vagina is made of thick, elastic tissue. That's meant to stretch the baby, and it can incorporate the penis, and it can open. The anus is not. It's very thin. thin tissue. It has a sphincter. Okay, so it's the highest STDs for anal. When you have anal sex, you're at the highest risk for getting STDs.
It's not.
Because what you're doing is the penetration in that area causes rips and tears to the lining. The lining is very thin.
Yeah.
So everything is open for bacteria. It's open for STDs.
Yeah.
It's even open for HPV, which can cause anal cancer.
Wow.
Yeah. So you have to be very
So scientifically and medically,
it's not made.
Anus is not made for sex.
It ain't
made us for sexes.
There are people who actually will tell me, no, it's okay to have, and that is their choice.
Yeah.
But the tissues are very different, and the infection rate is much higher in the anus.
Wow.
So I would just caution people. Plus, you don't ever want to have anal sex and then go to vaginal sex.
Yeah.
You're passing away.
Like in the same setting.
Yeah. And the same.
People will pass on E. coli into the vagina. Now that will cause a very
foul odor.
Yes. And then you can also be at risk for urinary tract infections as well. So you would need to wash off the penis before you would go into the vaginal area. I would just caution against
Just try not to do that.
You know, what
To each
people
his
do in their
own.
own right bedroom is up to them. And so those are reasons why you can have, and sometimes, honestly speaking, some women come in and they think, okay, I have a smell. Well, they just sweat a lot. You may need to wash 2 or 3 times more.
Yeah.
If you notice you're a sweater, or you know what I'm saying?
Or you got extra crevices and
So you may need to keep it clean. And then what we really notice is the wiping. When you wipe from front to back.
Yeah.
A lot of women do that wrong. They they're doing like this and I'm like, no ma'am, tissue is cheap enough. So wipe from front to back.
And get rid of it.
front, back, drop.
Let it go.
1, 2, 3.
And if you're noticing a smell, it could be coming from your rectal area. You may not be
clean all the way.
I hate to tell women that, but ma'am, you need to wipe.
Your booty stink. And it's their back because you have to cleanse that as well.
Yeah.
So what about after sex? Like wash up, clean up.
Yes.
Like I've known people say like after you have sex you gotta go pee it out.
Pee it out.
Is that an absolute must?
Yes.
What if you're sleepy?
I know. Yeah, I don't gotta pee. Listen, you can take your chances, but what it does is, there are 3 holes down there. You know? So you have the bladder opening, and right by that is your vaginal opening, and then right behind that is the rectum. So for women, we have 3 different holes. Right. And so when you pee, all it is doing is making the urine come out of the bladder so that no bacteria tracks up into, because that's how we get a urinary tract infection. So you want to urinate so that you can help yourself, and then wash immediately after that. So that you won't, and that will kind of keep the whole entire area clean. So I tell women all that. Pee and then wash.
Pee and wash immediately.
And wash, yes.
Now, can you pee and wipe, or do you have to do a full wash if you're tired?
What kind of pee? I'll take some wipes.
Put some wipes by the bed.
Right.
In the drawer.
Now, I don't know if these wipes will get rid of E. coli. I hope they do. So I like soap. Soap and water will cleanse pretty much everything. So I like soap and water after sex. And I know you don't have to do like a full shower. You can kind of do
a little wipe down, a little
and then wipe it down just to make sure, because in the morning when you wake up and that burn happens, you're going to wish that you had peed and washed.
So, and what about the men? They need to do that too, right?
I think that everyone, and this is not always possible, but I think you should be as clean as possible before you even have sex.
Before and after,
so
right?
Everyone should be clean before they have sex, and then the men can kind of wash down too. I would wash the penis down as well. Real quick wash right after, so they can lay down. They have to pee as well. So men are not prone to UTIs. They have a long urethra, which means there's a long tube that goes from the tip of the penis all the way to their bladder. Yeah. So it's hard for bacteria to track all the way up.
Go up in it.
It's a long way.
Yeah. So we got a hole.
Let me tell y'all, men can always get away with not doing something. And they can not take a bath for 3 days and nothing will happen. We will be having odors coming out of everywhere.
Got it twice a day.
Wash it, honey. Sometimes I have to wash 3 times. I go to the gym. I'm taking another shower.
Keep it clean.
Keep it clean after sex, ladies.
Yeah, for sure. Any products that you would say to not use? I know we talked about not douching, but anything else that comes to mind that's harmful?
I would say, if you like lubricants, make sure it's a water-based lubricant.
Oh, okay. I didn't think about that.
Yeah. So a lot of people do like lubricants. And so I generally don't like the mineral ones.
Okay.
Sometimes they can have yeast infections. And use more water-based. That's more pH balance to your vagina.
Okay.
I like pH balance soaps for the vagina. So there's a lot of people that like certain ones, but there's a company that I like. Well, everyone has different companies. I'm not promoting one over the other.
Right.
But as long as it's a pH balance for the vaginal area, generally speaking, that's a good one to clean.
So you need different coochie soap.
Yes, not regular.
Now you can use mild soaps, like a lot of women can use Doves and
Ivory and stuff like that.
And if they think it's a mild, if that's what you've been using in your life, it's been working.
Right.
But I like a specific soap for the vaginal area.
Okay.
So you don't want to dig up in the vagina.
That's what I was gonna say. Do you need
you
to
don't
get
need
a
to
brush
go
up
in there, right?
You don't need to
scrub up in there.
Yeah, just the outer, right?
Just the outer. But let me tell you, there are a lot of OBs will tell you to use water. Now, some people are like, no, I'm not going to use water. I want soap. So if you use it, you want to just clean the outside lips. You know, you don't dig anything into the vagina. Nothing.
Right.
It will drain. It will cleanse itself.
Yeah, that makes sense.
What about shaving and waxing? And is that
good,
helpful or good? Now, because God made hair there,
right? So hair is somewhat protective,
right?
Yes. So you have to remember when you take all the hair off, you don't have that protection. So it may be easier for bacteria to. Especially after sex, y'all. If you don't have any hair, there could be more bacteria that's there. So that's why I'm saying really wash.
Yeah. Wow.
And after you get the hair off, you can get razor bumps. You can get all kinds of stuff. So you have to really watch that and exfoliate that area.
Yeah.
I'm not.
Get you a vajacial.
I like waxing or shaving, but I just think you need to just be very careful about cleansing after. And if you get a lot of bumps, it might not be for you. You might want to get that up.
Let the hair.
You got to see what it look like. What the head? What it look like?
A lot of problems after you got the antibiotics. If you get into pustules and whatnot, you might want to stop.
Because that don't look good.
Baby, your coochie ugly.
It's so ugly.
Why it's so dark?
Put some grease on it.
Because I was thinking about that, like God made us with hair on our private parts. Do we shave them?
They just keep it trimmed.
Now listen, I think a little grooming is okay. You can totally take it off.
But
just do a little scaping. A woman scape. And then do a man scape.
Okay. Triangle cut it.
Right. A heart for Valentine's Day.
I love you, baby. You know, people get their hair cut and there be names in the back. Name down.
Get the initials.
But too much time in your head.
You're like, baby, who did that?
I'm not against waxing. I just know that the shaving and the waxing, a lot of people have a lot of ingrown. So I would definitely go to somebody. If you're having a lot, then you might need the creams that fight ingrown hairs. Or you might need to, there's glycolic acid. They have certain things just for the vagina, which you can actually look up. They'll have peels or they'll have creams that would help with the razor bump.
Help it to look good.
So much. We have so much to do to keep ourselves together.
We do.
It's too much. It's a lot of maintenance. It's a lot of maintenance.
Hair, nails.
Skin, teeth, body. Eat right.
Drink them green drinks.
Yes.
Go to the doctor. Get your breast checked. Get your breast checked. Ladies, it's a lot of things.
Get your toes done. Get your nails done. Get it waxed. Get your lip waxed. Get your chin waxed. Get your beard done.
A worker and a wife.
I mean, sometimes sometimes something's just gonna have to fall by the wayside.
Yeah, you can't.
I
Sometimes
can't
can't do
get
it all.
everything done.
You're
I'm
like, I
I'm
tried.
sorry.
Okay.
Baby,
My
that's
hair
what
is
it is.
pressed. That's it.
Yeah, that's the best I can do.
I got a perm
washed
last
up.
week. That's it.
And my hair.
I washed.
Yes.
Okay.
Oh,
I cleaned my behind. Yes.
Oh my gosh.
That's good. I can't think of nothing else. What other questions?
Great. And we just want to know. You answered a lot of questions for me, and this was really, really helpful.
Yeah.
We need a doctor.
And I think a lot of times women just, you want to know, but you don't ask.
And you don't want to
scared
talk
ask,
about
or you're
it.
embarrassed to ask or whatever.
Oh, listen, and they can send y'all questions. We
Yes.
can answer.
Yeah,
Maybe
some
another
questions.
Yeah, for sure. We'll try to answer them for y'all.
Yes. Well, thank you for coming,
Thanks for
Brandy.
coming.
I love my girl.
Yes, love you. That's B Rocker right there.
Yes,
She is
yes.
so funny.
Oh my gosh.
She's full of jokes. She just laughs all day.
She was well behaved today, but she is so funny.
My giggle box.
Yes,
yes.
I was like, I like her.
It's generally my husband, and I'm the one giggling.
Oh my goodness. Her husband is
That's
so
how y'all got
funny.
married. That's how he got you.
Listen, I want y'all to know it was because people were
Yeah.
like, was it his muscles? Okay, that
Right.
was nice.
Right.
When I tell you, I'm talking
Funny.
about pee in my pants. All I did was giggle the whole day.
That's so fun.
And that's what me and Chris are
Yes.
cracking
All day. Laughing at everything. It's so good. It's so
Yes.
good. Well, we got to think of some stuff, or maybe if they have some questions, we'll compile them together and have you
Have
back.
you back. And we are, with Wife University that we're having in January. We would love you. You need to be our doctor for the sick ladies that's there.
Yes.
excited
We
about
may
my
need you.
Yes, it's gonna be great.
And I get one of the shirts.
We'll get you a shirt. We'll get you a shirt.
I saw them jackets. I was like, wait a minute. I'm buying one. For real.
Yes, that's because that's where you go.
Yeah, to wife you. And we just, your alma mater. But yeah, no, we definitely want to, utilize you and your expertise as a doctor at some point, just to help the ladies. And we just trying to encourage and empower women. Like, okay, God gave us the tools to be a help me, and that's what we gonna do.
Please, we all
We're gonna
can use
do
the help.
it. Yeah, we're not gonna throw in the towel and give up like we might want to.
Right.
Yeah.
Sometimes
When you see more people hanging in there, because the common thread is that everybody like, oh, they divorced. Or you just say in your head, well, marriages don't work. But no, they work. And
They
the more
can
women
work.
that we see that's fighting,
That
we come
Positive
together.
marriages.
It helps. So,
Wife
Yeah.
you, January the 21st.
yes.
Yes, you might come and get to see Dr.
She might be a student, but you can still,
answer a couple of questions. All right, well, until next time, we will see y'all. Peace
Thank
out.
you. Bye.